It's a Saturday.
The voice you're hearing belongs to Dr. Nicholas Theodore, Chief of Spine Surgery and Professor of Neurosurgery at Johns Hopkins University Hospital, ranked #1 in the nation.
Just about ready to start an emergency operation. This is a 70-year-old gentleman who presented several weeks ago with thoracic myelopathy, that is, dysfunction of the spinal cord in the thoracic region.
Because of COVID-19, the crew couldn't go to record these interviews on location as we had planned, so we asked our participants to keep audio journals on their phones.
He was having significant difficulty walking, and when I told him he needed surgery, his family immediately said that there's no way he will be coming into the hospital.
Thoracic myelopathy is an injury that occurs due to compression in the middle portion of the spine, pinching the spinal cord. Now, this can be congenital, that means you could be born with it, or it can be degenerative because of age and time. It can cause a loss of sensation. You can stop being able to feel certain parts of your body. It can result in incredible pain and the loss of the ability to walk.
And I told him that really our options are few, surgery being the curative option. He's got a large disc compressing the spinal cord. So after some cajoling, we were able to get him to come into the hospital. Thankfully, he tested COVID negative, and we'll be starting with an operation here shortly. Standing outside, and we just finished the operation. It's a beautiful sunny day. Birds are chirping. As I'm walking out, there's a series of signs on the way to the parking garage. The best superheroes wear scrubs. Thank you, medical heroes. Thank you. It's a nice sign of support. The operating room really is like the inner sanctum. And the reality is that once you're there, you sort of forget about everything else. So this patient had a very complicated and large thoracic disc herniation, compressing his spinal cord, which required about 3 hours worth of surgery. So this is an operation that we do with monitoring, and we essentially are monitoring the electrical integrity of the spinal cord as we do the operation. And that actually improved at the end of surgery, which is a good sign that this gentleman who could barely walk is going to be able to walk. Here as I walk out of the hospital and don't see anybody else around, and on empty streets, but again, just the birds chirping in the garage, it's a good day.